Continuing our conversation, our guest on This Is America and the World is addiction psychiatrist and neuroscientist Dr. Judson Brewer. Dr. Judd, as he's known, is Associate Professor of Psychiatry at Brown University, Executive Medical Director of ShareCare, a personalized wellness company, and author of the New York Times bestseller, Unwinding Anxiety. New science shows how to break the cycles of worry and fear to heal your mind. Dr. Brewer, thank you for spending some time with us talking about anxiety and worry and bad habits and addictions. Just so much to talk about. Let's define a habit and let's define a bad habit, okay?
So habit is basically something that we do repetitively without thinking. Okay. Bad habit is something that we do repetitively without thinking that's not helpful for us.
Okay. So run down, in case folks might have not heard our first half hour, 4 or 5 different things that would fall under this bad habit category.
Some of the bad habits that I've seen lately that have really ramped up, stress eating, worrying, smoking, drinking, and several flavors of social media use, from somebody excessively checking the news to just going on their social media feeds to distract themselves or when they're bored.
This last year, which I affectionately call the lost year, has created almost like a pandemic of anxiety. Is that a fair statement to say? I mean, boy, people are short with each other, and we're living in a polarized society, and it just seems like everybody's kind of on edge.
And the data bear out what you're pointing out. So we've seen, interestingly, anxiety had already been on the rise over the last 4 or 5 years. But in 2020, what did you call it? The lost year? That's fabulous. So in that lost year, we have certainly not lost our anxiety. In fact, it's spiked. It went in, psychological distress, I think, has gone up 250% in one study I saw. Diagnosis of I think anxiety disorders went up 290%, something like that. So we've seen this huge spike in anxiety.
I want to just circle back on something you just said, which was in the last 4 or 5 years, we've seen a gradual ascendancy in this area. What have you learned in your lab or in your research about that? That's fascinating.
Yeah, it is really interesting. So one thing that this is borne out on research that's been done, over decades, but we're seeing this come to life, which is our brains really don't like uncertainty. There's actually a term and even a way to measure it. It's called intolerance of uncertainty. So some people, with uncertainty, they can tolerate it. And we're all on some spectrum about, how much we can tolerate uncertainty and how little we can tolerate uncertainty. So if you look at what's been happening, say over the last 5 or 6 years, there's been an increase in uncertainty. So for example, politically, in the previous presidential administration, there's a lot of uncertainty because he did things very differently than previous presidents. So some people like that, some people don't, but it just raises the collective anxiety because in general, our brains don't like uncertainty. We've seen uncertainty environmentally. We've seen this economically at different times. Yeah. So, it's not that it was never there, but over the last 5 or 6 years, we've seen, it seems to have ramped up a little bit. And then in 2020, it really spiked.
Okay. With the, so the book is focused on anxiety, which I've come to understand is a kind of a physical sensation. You couple it with worries in play, usually. And worry, I'm gathering from our conversation previously and reading the book, is a kind of fear of not being in control. Am I accurate about that?
Yeah, you can think of it as a fear of not being in control, or basically, fear of the unknown, even. Where, it starts to get driven when there's something that's unknown, and we're afraid of that, and so we start to worry. It ramps up our worry, and we start worrying. Oh, what about this? What about that? As we start thinking about all the worst case scenarios.
Let's focus on the worry and the anxiety as habits. Mm-hmm. And how they can undermine our sense of happiness and well-being if they are negative, bad habits, huh?
Yes, I didn't ever learn that anxiety and worry could be driven habitually in medical school or residency. In fact, I've been trained generally to focus on medications and giving people medications. There's a term in medicine called number needed to treat, which gives us a quick and dirty estimate of how well a treatment works.
Huh.
So the higher the number, the worse the treatment. So with medications, which is our gold standard right now for anxiety treatment, that number needed to treat is 5.2, meaning I need to treat more than 5 patients before one person shows a significant reduction in symptoms. So basically, I have to play the medication lottery with my patients, and then one of them is going to benefit, the other 4 aren't. Then I have to look at, well, what am I going to do with the other 4 if they're not significantly benefiting from the medication? So that background, I say that because that my own anxiety of how do I treat my patients with anxiety led me to look back at the literature to see what I was missing. And here it turns out there's a really rich literature from the 1980s suggesting that worry could be triggered by anxiety. And when I saw that, when I read that, this light bulb went off in my head, because I've been studying habits for a long time. Yeah. But I never thought to combine the idea of anxiety with habit. And I could develop programs and treatment programs for habits, but I never thought to develop a program to treat anxiety like a habit. And long story short, we developed this Unwinding Anxiety app and studied it. We did a study with anxious physicians. We got a 57% reduction in clinically validated anxiety scores. We did a study with people with generalized anxiety disorder, and we got a 67% reduction. Here, we could calculate that number needed to treat. With this Unwinding Anxiety app, that number needed to treat was 1.6. So very different than the 5.2 that's seen with medication.
So, a person comes into the office and they are feeling anxious, and first level is talk therapy, and then perhaps you might prescribe some medication to alleviate the anxiety. Mm-hmm. So now we have therapy plus medication. So let's set that aside for a second and go to this app that you're talking about. Mm-hmm. What's going on in the app that is different from talk therapy and medication?
So the difference here is we start in the app with training people to learn how their minds work. So the app is set up where it's got about 10 minutes a day of animations, videos, and in the moment exercises to help people understand a concept and put it into play in their own life, okay? Over the course of 30 core modules, they learn first how their mind works, and then second, how to work with their mind. So there, we can give people bite-sized pieces of evidence-based training. And that's different than talk therapy, where somebody might come into a therapist's office, once a month or once a week or whatever, or I might prescribe a medication and somebody comes back a month later and we check to see how the medication worked for them. So the app is set up to really, give people that in the moment training so they can really work with their anxiety in the moment. If you think of it, another way to think of this is, our brains have set up this habit system to help us learn behaviors in a specific context. So if somebody's, fortunately, people don't learn to get anxious in my office or learn to worry in my office. They don't learn to smoke in my office, all these things. So the idea was, could I bring my office to them and deliver training in context so that they could really start to see how they were perpetuating these habits and also start to step out of those habits right at the moments when they were being triggered.
I don't want to lose the thread, but we've got to take a little break. Talking with Dr. Judd Brewer. He's at Brown University right now, has a distinguished career as a psychiatrist, an addictive psychiatrist, a psychiatrist specializing in addictions, also a neuroscientist as well, and this wonderful book, Unwinding Anxiety. We'll pick up the thread on the other side. This is America and the World. Underwriting for This is America and the World is made possible by the Japan America Society of Washington, D.C., the National Association for Children of Addiction, Faces and Voices of Recovery, the Forerunner Foundation, the Rotendaro Family Trust, the Republic of Uzbekistan, the Sultanate of Oman, the Kingdom of Morocco, and the Embassy Series, Uniting People Through Musical Diplomacy. So now we have the opportunity of someone who's, quote unquote, on location, going through a bad patch, let's say that, and they can utilize technology now, your Unwinding Anxiety, is it .com? Yeah, something like
yes.
that. To be in the moment, learning how their brain works. So what are you suggesting that they do in the moment when they're going through this bad patch, craving something to eat or something to drink, or they're just all in their head about worry?
So with worry, we can have people, so with the app, they can pull out the app and it actually gives them a couple of different tools that they can use. So in addition to learning how their mind works so that they can start to work with it and become kind of tap into that same process that forms the habit of worry in the first place, can actually overcome that process of worry. We give them grounding practices and grounding tools as a way to kind of keep themselves in the present moment so that they can then utilize their thinking and planning part of their brain to learn. So the grounding piece is important because, the more freaked out we are, the harder it is to be able to utilize any aspect of our mind. So just being grounded and helping somebody kind of ground in the present moment is really helpful. And this is really important with anxiety and worry because, we tend to be worried about something in the future, right? It's the more our mind is drifting off into the future, the more we're caught up in worry. And so if we can just ground in the present moment, it keeps us from getting pulled by those currents of fear of the future. Basically.
So what you're saying is, with the smartphone and the app, it's kind of like you're over their shoulder, saying, "What's going on right now?" And
yes.
Slow down, and let's examine that together. Is that
yes?
Got it?
Starting with, let's take a deep breath together.
Okay. So. Okay, I want to build on that. So with a bad habit, you got a trigger, some kind of stress, and then the behavior, and the behavior is in the service of looking for some kind of reward.
Yes.
And it might just be the reward of distraction, or it might be the reward of, if it's a negative, kind of beating up on yourself. Yeah?
Yes, I see that a lot where people tend to judge themselves, and in today's world where there are many opportunities to compare ourselves to others. If you look at social media, for example, we have many, many opportunities to beat ourselves up and judge ourselves.
Well, and certainly waking up with a hangover, that would be a good opportunity to beat up on yourself.
Absolutely. Oh, I did it again. Yes.
Yes. And did it again. So now we want to, maybe somebody doesn't have the opportunity to use the app. Let's walk through some steps there. So you say the first thing you want to do is kind of not beat up on yourself, but to say, okay, here we are in the reward phase of this thing. You want us to look at it, accept it, investigate it, and take note of it. I'm going to lob that over the net and let you run with that.
Yes. What you're highlighting here is, so if we take the acceptance piece, if there's something that's unpleasant, or let's say, we have a hangover and we're beating ourselves up, we tend not to be open to learning from that moment. And so we've got to accept that whatever happened, because it'll open us into a growth mindset so we can actually learn. You're talking about investigating. When we investigate, this is really the critical piece for changing any habit. The only way a habit will change is through updating how rewarding that habit is in our brain. So for example, if we're doing something as a habit, we're not paying attention to how unrewarding it is. Let's say smoking a cigarette or overeating. We're not going to change that behavior. Willpower really just doesn't work in situations like this. So here, that investigation I have people ask a simple question: what am I getting from this? So for example, if I have a patient that wants to quit smoking, I have them really pay attention as they smoke that cigarette and ask, well, what's this taste like? What's it smell like? What am I getting from this? They realize that cigarettes taste like crap. And so that reward value in their brain gets updated. It's less rewarding, not because of anything more than them just paying attention and seeing, oh, wait a minute, this really isn't as good as I remember when I was 13 when I started smoking. So that investigation is really critical, whether it's smoking or overeating. As somebody overeats, we have people pay attention. Oh, how does this feel when I overeat as compared to when I don't overeat? Oh, it feels much worse. So that reward value starts to drop. So that's where the investigation comes in as well. So we've got to accept, okay, I'm overeating. What can I learn from this? Investigate. Oh, what's this feel like in my stomach? Oh, not so good. We start to become disenchanted with that. And we can also we can note, so we want to be objective here. We just want to be the person collecting the facts, right? As compared to editorializing. So it's not, oh, I overate. Oh, and now I'm a bad person. Going back to what you were saying, we don't want to be judging ourselves in those moments, but we just want to be going, oh, I overate. Okay, what's that like? So that helps us see things much more clearly.
You used a word or two words in this drive to stamp out a negative or a bad habit: curiosity, which we're talking about right now, curiosity, and kindness. Talk a little bit about where the kindness piece, the curiosity is investigation, the kindness piece. How does that fit into the equation?
So when our brains become disenchanted with an old behavior, whether it's overeating or worrying, we've got to give our brain something better. I call this the BBO, the bigger, better offer. And curiosity certainly feels better than a craving, or feels better than overeating or whatever. But kindness also feels better than bad habits such as beating ourselves up. So we can simply, if somebody's in a habit of judging themselves, they can ask themselves, what am I getting from judging myself? And how does this feel compared to when I'm kind to myself? So both curiosity and kindness feel better than the alternatives like anxiety or self-judgment.
I know that you've been meditating for a long time, conduct retreats and meditation. Where does this idea of mindfulness fit into exactly what we're talking about right now vis-a-vis habits?
So meditation, I think of meditation as falling into a larger category of mindfulness. So meditation helps us train our minds to be able to see, be aware of what's happening. And so I think of mindfulness as having two sides of a coin. So if you think of awareness being one side and that attitude of curiosity being the other side of the coin. So we can be aware of things, but the curiosity is really what helps us see things clearly as compared to going in with some preconceived notion or judging what's happening. So that's that larger piece of mindfulness, and meditation falls within that, but we can certainly be mindful when we're not meditating.
So as it relates to the habits, being mindful, which I gather is training oneself over a period of time to be more present, in the present, if I can use those two words in the same sentence, being more present in the present. You and I are having a conversation right now. Obviously, I'm focused in on the conversation. You are focused in on the conversation. Everything else is off to the side. Okay. Easy for us to say at this moment. The interview is over, okay? For you, for me. And we run into, you've got 8,000 emails stacked up, or your phone, which you've turned off, now has a number of stress comes in. Do you have things that you would go to, or are you able to slow down, be in the present moment, and say, okay, I've just spent an hour with Dennis, so it's normal that all of these things have stacked up. How do you handle that situation?
I kind of learned that the hard way.
Okay.
So I certainly had a habit of procrastinating when things piled up.
Yes.
And I would notice that I would check news. Well, what's new? What's new? In the guise of keeping myself informed in the world. Yet the things would stack up more. So I learned, if I procrastinate, it actually makes things worse. So as I started paying attention to the procrastination habit, I started to become disenchanted with the procrastination itself, and then realized it's actually, I've got to do this stuff anyway, right? I've got to check my email, I've got to check my phone. So I could do it begrudgingly, like, I've got to do this. Or I could bring curiosity in and have that curiosity kind of lead me by the hand. And I find that it's much more enjoyable to go in and be like, let's see how many emails I have, as compared to, let's see how many emails I have. Procrastination happens when we think of something that we have to do and it makes us anxious, or we don't feel like we're going to do a good job. And so that unpleasant feeling triggers us to procrastinate, so we can avoid, being with that unpleasant feeling. And that's the reward. It's like, I'm distracting myself. So we can map that out, and then we can see how that feeds back and drives more procrastination the next time we think about the project. And then we think how much farther behind we are, which then tends to drive it even more. We can follow the same process where we can ask ourselves, well, when I procrastinate, what am I getting from this? And then we can compare that to actually just going and doing the work. Most people that I talk to and work with their procrastination habits, they say, well, it actually feels fine when I get started on the project because I know I have to do it anyway. And it feels better to get it done earlier rather than, waiting until the last minute and not doing as good a job as I could have.
So what is there operating in our brains that causes us to want to procrastinate? Just that it's a tough task, or just that it's something we don't want to do? Is that it?
Yeah, it goes back to our survival mechanism where, think of, you're chased by the saber-toothed tiger. That's unpleasant, and that trains us to run, and we learn to run. In the same way, thinking about the task is, to our brain, it's like the saber-toothed tiger. It says, ooh, this is unpleasant, make it go away. And we just learn that we can do all sorts of things to procrastinate, from eating to checking social media to binging on Netflix.
Wow. We're coming to the end of our time. I love that tracing your fingers. Can you do that in just 30 seconds to tell our folks? I just love that exercise.
Yes, and I've got a YouTube video that explains all the neuroscience behind it. But basically, as we breathe in, we trace up the outside of our pinky. As we breathe out, we trace down the inside. Mm-hmm. As we breathe in, we trace out the outside of our ring finger. Mm-hmm. As we breathe out, we trace down. We'll do one more together. As we breathe in, we trace up our middle finger. And as we breathe out, we trace down. And then somebody can continue for 5 breaths, for 10 breaths, for 15, for 20.
It just calms us down, huh? Puts us in the present moment. What a treat to spend this time with you. Unwinding anxiety. New science shows how to break the cycles of worry and fear to heal the mind. Dr. Judson Brewer, just so wonderful to be with you today. Thank you, Doctor.
Oh, thanks for having me.
Good to be with you. Thank you.
That was great. Thank you.
Thank you. If you are in crisis or know someone who is, these resources offer immediate help. For information about This Is America in the World, visit our website, thisisamerica.net, or our YouTube channel, This Is America TV, and follow us on Facebook and Twitter. Underwriting for This Is America in the World is made possible by the Japan America Society of Washington, D.C., the National Association for Children of Addiction, Faces and Voices of Recovery, the Forerunner Foundation, the Rotendaro Family Trust, the Republic of Uzbekistan, the Sultanate of Oman, the Kingdom of Morocco, and the Embassy Series, Uniting People Through Musical Diplomacy.